In a fascinating interview, Dr. Michael Greger of nutritionfacts.org was talking about how powerful a particular diet is, so much so that it beat out a $75,000 per year medication. And in this video, we're going to hear all about it. So let's first hear that clip from Dr. Greger and then come back and look in detail at which foods were used specifically and made up this diet. If you find these videos helpful, I would be so grateful if you could hit the like button. This hopefully helps it reach more people who might need to hear it. Here's Dr. Greger.
The list of diseases that we're able to impact, and not just impact positively, but in many cases, like with Crohn's disease, for example, or now ulcerative colitis. Now we actually have randomized control data on ulcerative colitis, not just helpful, but the most effective medical intervention, period. Not the most effective natural intervention. No, works better than any drugs. We're talking 100% remission rate by 1 year, 90% remission rate by 2 years. No drug can do that. And, what do? We use the plant-based diet. And now we just had published, I just scripted some videos on the ulcerative colitis data. Same absolutely remarkable results, better than these new biologics, which cost minimum $35,000 a year, up to $70,000 a year. The horrible list of potential side effects. They're taking these immunosuppressant drugs, and they all don't work as good as putting people on a healthy diet and treating the cause. What a concept. And switching to a plant-based diet has been shown to achieve far better outcomes than those reported on conventional treatments in both active and quiescent stages in both Crohn's and ulcerative colitis. For example, here's 1 year remission rates in Crohn's disease, 100%, compared to budesonide, an immunosuppressant corticosteroid drug, a half elemental diet, meaning like at-home tube feedings, the $35,000 a year Remicade, or the $75,000 a year drug Humira. Safer, cheaper, and more effective? Maybe we should recommend plant-based diets for inflammatory bowel disease.
In this study, during hospitalization for induction therapy, patients were given a diet that included vegetables, fruits, pulses such as beans, soybeans and peas, potatoes, rice, seaweeds, miso soup, green tea, plain yogurt and eggs. Foods that were considered risk factors and were greatly limited included all meat, cheese, butter, margarine, sweets, soft drinks, alcohol, bread and fish. Fish was allowed once a week and meat once every 2 weeks. But it's this study that really blew scientists away. Crohn's disease patients were placed on a semi-vegetarian diet, meaning no more than half a serving of fish once a week and half a serving of meat once every 2 weeks. And they achieved 100% remission rate at 1 year and 90% at 2 years. Foods included were initially white rice, which was then moved to brown, boiled potatoes, vegetables, fruits, beans, miso soup, soy foods, and they were allowed eggs and plain yogurt as the lacto-ovo component. Next, we'll look at the food that beat out dementia drugs and the amazing things this food did to the brain. To view that video, you can click the middle of the screen now, but it will also be pinned to the top of the comments below.